Hi, my name is Mike Milgie. I'm a licensed Medicare health insurance broker. I'm also a card-carrying Medicare man myself, so I've gone through what you're going through. I've helped many people transition in the process into Medicare from whatever insurance they had before. Today's installment is about Medicare Part B. Medicare Part B is everything that's outside of an admitted hospital stay. So these are the things that are covered in Medicare Part B. As I mentioned, all services outside of an admitted hospital stay, which would be covered under Part A. Primary care, all your doctor stuff, primary care specialists, that's going to be covered under Medicare Part B. If you need an MRI, X-ray, diagnostics, Medicare Part B. Blood work, Part B. If you need durable medical equipment, like a wheelchair, hospital bed, God forbid, cane, crutches, that's going to be covered under Medicare Part B. Certain medications, chemo, other injectables, even dialysis, that's covered under Medicare Part B. Wellness visits, insurance companies like to come and see you. Medicare pays for wellness visits. They pay for home health care following a hospital stay. And some shots and vaccines are covered. Medicare Part B is not free. There's going to be a premium to be paid for it. So, let's talk about the costs of Medicare Part B. So, Part B costs. Okay, the base premium, monthly premium you're going to pay each month for Part B in 2023 is going to be $164.90 per month. All right, that is the base premium. But Part B is income tested, so that means that if you're over a certain income level, you're going to pay more money. So for a single, it's $97,000. So if you were showing more than that, you could pay more, depending upon. There's certain breaks, and I have a form that I can send anybody that would like to see. But if you go over those income breaks, they're going to give you what's known as an income-related monthly adjustment amount, which is IRMAA. All right, so they add money to your premium because you're making more money. So you could go all the way up to a premium of $578 per month. Okay, there's income breaks for if you're filing jointly with a spouse. Obviously, it's more. It's closer to $190,000, but I'm not going to get into those specifics at this juncture. I do have a form I can send. Contact me and I'll send it over to you. But for most people, this is the number that they're going to pay. If you're collecting Social Security at the time when you sign up for Medicare, they're going to automatically enroll you in it, and they will automatically deduct whatever your Part B premium is from your Social Security payment. All right. If you're not collecting Social Security, they will send you a bill, and the bill will be for 3 months. So it'll be 3 months worth of this. Shortly thereafter, if your income is a little higher, they'll send you another little letter and say, hi, we looked at your income from 2 years ago, and we're going to have to raise it up. It might not be up to this, but it might be a little bit more. But as I said, for most people, it's $164.90. Now, when you use Medicare Part B, all right, there's costs there too. So with Medicare Part B, there is a deductible. It's an annual deductible, and that means it's paid only once, all right? So if you're on Medicare, you use your Medicare Part B January 1st, you are responsible for the first $226 of your doctor visit. Because remember, it's doctors, tests, whatever you're doing on the Part B, you're going to pay the first $226. After that, you're going to be responsible for coinsurance. Your coinsurance and your responsibility after this is paid is going to be 20% of all costs. All right? Medicare pays 80%. Of course, it's kind of like Hospital A. You know, they're paying you have to pay a $1,600 deductible. After this deductible, and you're paying 20%, it actually seems like a pretty good deal. So if you're obviously at a $300 doctor, all right, and you're gonna pay 20%, and he charges Medicare, he gets paid $300, 20%, okay, you're looking at a copay of $60. You know, on the surface, that looks pretty good. But whenever you have coinsurance, you have to remember, a percentage can be of a very large number. As an example, on what we mentioned before, you know, certain injectable medications are covered under Part B. If you looked at a medication like chemo, God forbid, and I hope it never happens, you know, chemo could be, I don't know what it costs because I've never had it, but I did know somebody that was on it. You could be looking at $100,000 of cost, in which case you would pay 20% or $20,000. So, Medicare is actually pretty good if you don't get really sick with it. Obviously, if you're paying a co-insurance on any insurance, doesn't matter, even if you have company insurance right now and you have a co-insurance, you always have to be aware that that co-insurance, and it's a percentage, the higher the number of the cost of service, the higher you're going to pay, whatever the percentage is going to be. All right. Again, another case for thinking about putting a health insurance plan in place to control your costs. Medicare does not have a lid. It doesn't have a cap. You're just going to keep paying 20% of whatever it's going to be, and then what's going to happen is the calendar year switches, December 31st, January 1, the clock resets, and you're starting to pay all over again. All right. Visit my website, mymedicaremike.com. There's the videos in there. There's a lot of information. You can always send me an email, mmilinsurance@gmail.com. At the end of the day, if you just want to ask me a question, feel free to give me a call, 631-774-3786. I can't thank you enough for watching. Thanks.